Please note that ZFF strictly abides by its data privacy policy to ensure the confidentiality and protection of your personal information. This webinar is both a celebration and a learning opportunity. We gather to acknowledge the efforts of local governments in advancing family planning and ASRH to reflect on systems and leaderships that have made this progress possible. At this point, I would like to acknowledge our guests, partners, and participants for our last day. We have a total of 368 attendees on Zoom, all eager to learn from the experience of the city leadership teams of Iloilo and Las Piñas. We also have participants from the rest of our 24 TCI cities, those that have already graduated and those preparing to graduate soon. And of course, welcome to all the health professionals joining us from the field. Please note that PRC continuing professional development units are accredited for today's webinar. For professionals registered, a complete registration, attendance, and evaluation of this session entitles you to 1 unit for medicine, 2 units for nursing, and 1 unit for midwifery. This webinar series brings together local government leaders, healthcare professionals, young advocates, and international partners. Our objectives at the end of this forum are: first, to recognize the effective leadership advocacy, community engagement, and strategies to strengthen health programs and services. Second, to understand the importance of grassroots involvement in family planning and adolescent youth sexual reproductive health awareness and service delivery. And last, to enhance adolescent friendly services through inclusive program design, coordinated referrals, and multi-sectoral partnerships. Let us have a short review of our program for today. We will highlight the cities of Iloilo and Las Piñas. Both cities have adopted adolescent-friendly services, high-impact practice, consulting with youth leaders, developing facilities, training health providers, and creating innovations with youth and other partners. After each city's presentation, our regional partners will share their response, followed by a brief question and answer. We will then move on to one of the most exciting parts of the program, the graduation of our TCI cities and their acknowledgement as a globally self-reliant city on urban reproductive health. I'm sure everyone is ready to go, but before anything else, for those who are new to this webinar or to our organization, one more question needs to be ticked. What is the Challenge Initiative?
Did you know a single investment has the power to tackle a multitude of global challenges? Urban poverty, maternal and child deaths, climate change, gender equity, and human rights. This investment is family planning. Evidence shows that for every dollar invested in family planning, society reaps $120 in benefits. Where can we invest to have the greatest impact? In the rapidly growing urban slums of Asia and Africa. 70% of the world is expected to live in cities by 2050. 90% of this growth will be in Asian and African urban areas. And most of that growth will be in poor urban slums. Providing family planning to women and girls living in these slums can ensure a brighter future for all global citizens. When a woman or girl can decide whether and when to have a child, she is empowered to pursue an education, a job opportunity, or start or grow a family. This leads to many benefits: better health for children, women, and families, increased attendance and better performance in school, improved economic conditions for communities, lower healthcare costs, less stress on urban infrastructure. The Challenge Initiative offers a groundbreaking opportunity to have a dramatic impact on underserved urban poor communities. The initiative is Business Unusual, considering financing, scale up, and sustainability in providing urban family planning solutions that work. It is a strategic shift away from the traditional aid model because local city governments decide if they want to participate, committing their own human and financial resources, political will, and ideas for solving family planning challenges. In return, cities get access to technical expertise and high-impact, evidence-based solutions to adapt for their local context. The initiative also provides funding through its Challenge Fund, which is open to other donor contributions, ensuring even greater returns when cities implement their own family planning programs. In addition to helping solve one of the most pressing issues of the 21st century, contributing to the Challenge Initiative provides major leverage for both cities and donors. Invest in innovative, high-impact family planning programs with trusted partners and proven solutions. Join our challenge.
The Challenge Initiative is co-funded and co-managed by the Zwillig Family Foundation, the William Gates Senior Institute for Population and Reproductive Health, and Bayer International, with technical support from Johns Hopkins Bloomberg School of Public Health. TCI stands out for its use of high impact practices or HIPs from hubs in East Africa, Francophone West Africa, Nigeria, India, Pakistan, and the Philippines for diffusion to other cities with the express goal of fulfilling the unmet need of women, men, and adolescents in urban areas. One such high impact practice developing adolescent friendly health services is the essence of our presentations for today. Our presenter cities of Iloilo and Las Piñas have adopted and improved upon the HIP design, resulting in improved ASRH outcomes for their cities. Their innovations will be featured for today. Through partnerships, coaching, and capacity building with 24 city partners throughout the country, TCI Philippines is proud to contribute to the improvement of ASRH outcomes, helping produce, within 5 years of partnership, 22 partner cities that have met the national adolescent birth rate target of 30 per 1,000 or less. 555 certified adolescent-friendly health facilities, and 2,881 healthcare providers trained on adolescent job aid, ADEPT, and other adolescent communication trainings. Before we proceed to our featured city presentations, let us hear a statement of support from one of our primary partners, the Commission on Population and Development, represented by Ms. Mylene Mirasol Kiran. Known to everyone as Mai, Ms. Mylene Mirasol Kiray is the Chief of the Knowledge Management and Communications Division of the Commission on Population and Development. She acquired her Master's in Population Studies from UPPI and her bachelor's degree in Broadcast Communication from the College of Media and Communication from the same university. She also worked in the Department of the Interior and Local Government, Cordillera Administrative Region. For those who find her voice familiar, she used to host the CPD online talk show, Usap Tayo sa Family Planning. Without further ado, we welcome Ms. Mylene Mirasol Kiran.
To our esteemed guests, Mr. Kodjo Loco, the Chief Investigator of the Challenge Initiative, Mr. Osir Panadero of the Zwillig Family Foundation, to the local Chief Executives, Health Officers, Program Implementers, and Community Champions from our graduating cities. Isang masayang pamilya sa ating lahat. On behalf of Undersecretary Lisa Grace Versales, we are honored to be with you all today to celebrate a transformation rooted from compassion, innovation, and of course, commitment. To our partners from the Zwillig Family Foundation and the Challenge Initiative, We applaud your steadfast support and partnership in advancing responsive, sustainable, and localized systems for family planning and adolescent sexual and reproductive health. Both the data and the lives impacted by the results speak for itself. Myriad accomplishments are evident in our areas. There have been milestones achieved, and we believe the leadership track and sustainability of interventions are top of mind in these. Your graduation today demonstrates your commitment to ensuring that health outcomes are the goal in each of the communities you serve. We, from the Commission on Population and Development, are deeply proud of what you have achieved. Through the TCI model, you have proven that investments in local leadership and systems building are central to breaking the cycle of poverty, early pregnancy, and unmet need for sexual and reproductive health services. At this moment, let us take this opportunity to recognize the remarkable contributions of the graduating cities under TCI. Iligan City has demonstrated strong leadership by fast-tracking outcomes through prioritizing family planning and adolescent sexual and reproductive health and local development. Naga City has taken bold steps towards zero adolescent pregnancies, demonstrating that transforming vision into action could lead to meaningful and lasting change. Santiago City has empowered young people by developing peer educators through close collaboration between the city and barangay leadership. Pinyan City has strengthened family planning outreach by effectively integrating demand generation strategies. Mandaue City has expanded access to reproductive health services by launching the Women's Health Caravan, bringing care closer to communities. Manila City has significantly increased the number of new family planning acceptors and built deeper community trust through its Bayanihan outreach. Iloilo City has set a benchmark by establishing adolescent health-friendly facilities that promote safety, comfort, and responsiveness to adolescents' needs. Lastly, Las Piñas City implemented a multi-sectoral approach by creating a comprehensive network for coordinated support for adolescent and development concerns. Each of your cities has embraced the principles of evidence-based decision-making, capacity building, and institutionalization. Ensuring the gains you have made will outlast projects and remain embedded in the community systems is truly critical in your success. As a continuous commitment to lead and sustain, graduating from TCI is not an endpoint. It is now your city's duty to sustain your progress and motivate others to guide, support, and proactively create an efficient and equitable health system. The Commission on Population and Development is dedicated to bolstering and expanding your interventions as we look into the future. Our objective is to grow, adapt, and sustain these high-impact approaches across the country. Let us keep investing in systems that uplift, empower, and protect every Filipino, more so our young people and the women of our communities. Congratulations once again to our graduates. Your leadership brings hope and continued progress. Patuloy tayong magkaisa para sa bagong Pilipinas at para sa isang planado, matatag at maginhawang pamilyang Pilipino.
Thank you, Ms. Mai. Your message is a fitting start to the final day of our webinar series titled Expanding Access to Adolescents Through Adolescent-Friendly Health Services. From peer education to provider training to building supportive environments, these efforts are crucial in reducing unintended pregnancies and promoting adolescent well-being. We appreciate CPD's continuing support to advancing adolescent health through sustainable, people-centered solutions across the country. Today, we will highlight the importance of integrated, inclusive, and responsive approaches, the development of safe spaces, consolidation of services through consultations with the youth to meet the unique needs of young people. With that, to introduce our speakers and the featured cities for today, Let us hear from the Program Manager of TCI, Dr. Alphonse Ravael Guevara.
Representing the Iloilo City Leadership Team is Mr. Richard Magullado, who will share how the city developed facilities tailored to the needs of young people. Richard Magullado is a cum laude graduate of Bachelor of Arts in Communication and Media Studies from the University of the Philippines, Visayas. He subsequently earned his Master of Public Management from the same university in 2022. Currently, he is a Juris Doctor student in West Visayas State University College of Law. He carries with him 8 years of dedicated service in the population and development sector. He was a population program officer in the Iloilo Provincial Government before transferring to the Commission on Population and Development Region 6, where he worked as a planning officer, information officer, later head of the Knowledge Management and Communications Unit, and now the focal person for the Adolescent Health and Development Program in Western Visayas. Let us all hear from Mr. Richard Magullado.
Good morning, everyone. I am Richard Magullado, the Information Officer and the Adolescent Health and Development Focal Person of the Commission on Population and Development Region 6, and I am here today to discuss with you Iloilo City's journey in developing adolescent-friendly facilities and approaches. Iloilo City, known as the City of Love, is not just a cultural treasure. It is rapidly evolving into a vibrant hub of economic and infrastructure growth in the Visayas. Over the past 2 decades, the city has transformed into a progressive metropolis, attracting thriving businesses and students from across the Visayas, Luzon, and even Mindanao. As the city grows, so do the complexities and challenges of its youth population. Shaped by rapid modernization, Iloilo's young people face an evolving landscape that includes early sexual debut, risky behaviors, and mental health struggles. By 2019, the city's Adolescent Health and Development Program was at a critical juncture. With a change in political leadership after Mayor Jerry P. Treñas took office, there was an inevitable shift in the leadership of key city departments, including the City Health Office. This transition coincided with the retirement of key AHDP personnel, leaving behind a significant legacy. The Integrated Service Delivery Network, or ISDN for adolescents, which is supported by a local ordinance and led by the City Population Office, the City Social Welfare and Development Office, and City Health Office, was strengthened by the guidance of the Commission on Population and Development Region 6, the Department of Health Western Visayas Center for Health Development, and committed partners like the Family Planning Organization of the Philippines. We also have the Iloilo City Regulation Ordinance 2017-048, which establishes every Friday as Adolescent Day across all health centers in the Iloilo City, dedicating a specific day each week for focused services and support for the city's youth. Despite the progress, the pandemic struck just as the program was gaining momentum. Health services were redirected towards emergency responses, and adolescent services such as family planning and mental health were severely disrupted. The city's young people, comprising over 18% of the population, were left to face these compounded challenges alone. Adolescent pregnancy, which had temporarily declined during the pandemic, began rising again. As we can see in the graph, The adolescent birth rate, which is at 20.63 in 2021, rose to 26.75 in 2023. In 2022, Iloilo City partnered with the Challenge Initiative, marking a significant moment in the reinvigoration of its adolescent health and development program. This partnership, driven by the City Population Office, provided the much needed technical expertise and strategic guidance to navigate the transition. Our first engagements, conducted virtually due to the pandemic, included leadership orientations and the introduction of the TCI assessment tool. This tool gave stakeholders a new perspective, acting as a mirror that reflected both the challenges and untapped strengths of the program. With TCI's emphasis on locally owned solutions, the program quickly gained solid traction, empowering local leaders to take ownership of their goals. One of our first victories came with the revival of the information and service delivery network. Although disrupted by the pandemic, the network was re-energized through TCI's collaborative model. New and experienced program officers found direction and confidence through TCI's tailored training, coaching, and tools. The Health Leadership and Management Program was transformative, helping local coordinators see themselves not just as administrators, but as community leaders, advocates, and change makers. TCI's leadership approach instilled a sense of purpose, rooted in equity, inclusion, and accountability. The City Population Office led the charge on demand generation, launching innovative initiatives alongside traditional strategies. And inspired by the TCI University and its high-impact practices, we have conducted these activities. Katin-Aran MOU and Teen Hub at Nabitasan Integrated School, which created a safe, structured space to address social and reproductive health issues among marginalized youth. Balay Katin-Aran in Barrio Obrero also hosted activities like poster contests and family-focused discussions to raise awareness about relationships and sexual health. Newscasting, which is a citywide innovation and also a newscasting competition, gave our teens a platform to practice public speaking, media production, and ultimately build their confidence. We also have our Teen Ad Facebook group, which engaged over 2,900 members with adolescent-focused content and services, creating a digital hub for our youth. The Shape A teacher training also empowered our educators to better support students, positioning schools as key players in the adolescent health and development program. The Iloilo City government has also undertaken SBCC and AHD classes, the parenting talks, and peer helpers training, which ultimately promoted healthy decision-making, behavior, and peer support, reaching hundreds of youths and families across the city. We also have Family Planning Days, which is organized in each district, connecting women and adolescents directly to reproductive health and family planning services. A major breakthrough came with the retooling of the seat of the Barangay Service Point Officers, or the BSPOs. Understanding their crucial role at the grassroots level, the City Population Office launched a comprehensive retooling program for all 224 Barangay Service Point Officers across Iloilo City. Armed with updated tools and knowledge, aligned with the Family Planning Indicators and the Field Health Services Information System, or FHSIS, The BSPOs became empowered frontline educators and mobilizers in every barangay. Their efforts ensured that the messages of the AHDP reached every corner of the city. In a significant step towards inclusive youth engagement, the City Population Office also trained out-of-school youth as peer facilitators, ensuring that even the most marginalized young people have a voice in adolescent health efforts. These youth were empowered to take on leadership roles within their communities, providing youth-led support for the Adolescent Health and Development Program. By equipping them with knowledge, facilitation skills, and a strong sense of purpose, the program not only expanded its reach, but also reinforced the importance of peer-to-peer influence in promoting healthy behaviors and informed decision-making among adolescents. The city also saw strong policy support with local ordinances and executive orders reinforcing national goals. We have Ordinance number 2017-048, which formally established the ISDN in the city. We also have the Executive Order Series of 2021, which declared adolescent pregnancy as a local priority of the Iloilo City government. And ultimately, we have the Regional Development Council Resolution number 57, Series of 2018, which basically engaged Sangguniang Kabataan funds to augment adolescent programs and services. With TCI support, Iloilo City dramatically expanded its capacity to serve adolescents. The number of trained family planning providers grew from just 3 before the pandemic to 15 certified professionals capable of delivering long-acting methods across every health district. The city also scaled up adolescent-friendly health facilities, increasing the number of district health centers, striving for Level 1 certification, and appointing dedicated focal persons for adolescent care. Through these efforts, the Iloilo City Health Office ensured that each district center received the Adolescent Health and Development Program Foundation course, which provided healthcare providers with the essential skills and knowledge to deliver consistent, quality care. The city now aims to accredit every barangay health station as an adolescent-friendly health facility, vastly expanding adolescent health services to remote and underserved communities. As TCI worked to strengthen the leadership capabilities of the AHDP team, new levels of collaboration emerged. The technical working group expanded to include key stakeholders such as the Department of Education, the Iloilo City Police, TESDA, Sangguniang Kabataan, and local colleges. This broader coalition ensured that adolescent health received multi-sectoral support, aligning resources and activities towards a shared vision, a future where every Ilonggo adolescent has access to the information, support, and services they need to thrive. The Iloilo City Population Office, empowered by leadership, coaching, and an unwavering commitment to the youth welfare, launched yet another new and innovative youth engagement initiative. That is the Adolescent Health and Development Film Advocacy Contest. It is conducted in partnership with the University of the Philippines, Visayas, and gave our youth a creative outlet for health promotion. Meanwhile, Iloilo City Health Office HECHOSERA, which stands for Healthy Choices for Self-Confident, Empowered, and Responsible Adolescents, is a mentorship program led by community volunteers. It is designed to build life skills and provide psychosocial support, reminding us that healthy choices are nurtured by community compassion, especially when guidance comes from those who once walked in the adolescent shoes. Today, Iloilo City is proud to report a significant decrease in its adolescent birth rate from 36.76% in 2019. We now have an ABR of 23.9% as of 2024. We have also seen decline in the teenage pregnancy rate among 9 districts comprising Iloilo City. However, the work is far from done. There remains an undeniable urgency to continue the fight. The Challenge Initiative has not only revitalized systems but transformed people. From hesitant program officers to empowered community leaders, the TCI Iloilo City team has set a new standard for leadership. Bold, inclusive, and deeply committed to equity and impact. In the years ahead, Iloilo City will continue to protect its young people with TCI's leadership, fueling the drive to shape healthier, brighter futures for all. The love Iloilo City is known for will now be felt even more deeply by the youth it strives to uplift. Ladies and gentlemen, that ends my presentation. Thank you for listening.
Thank you, Sir Richard. Iloilo City's model of adolescent-friendly facility development stands as a testament to how environment design and streamlining of services can encourage youth to partake in their own health. To close our series of presentations, we now turn to Las Piñas City. Their city, which started engagement back in 2023, applied a multi-sectoral approach, engaging with other youth-serving agencies and organizations to create a directory for facilitating information sharing and referral. Sharing their experience is Dr. Justin Hernandez, who helped drive these initiatives. A medical officer at the Las Piñas City Health Office, Dr. Justin Gormafe Hernandez holds a medical degree from the Far Eastern University Nicanor Reyes Medical Foundation and is a fellow of the Philippines Academy of Aesthetic and Age Management Medicine Society. She was a former resident physician at the Las Piñas Doctors Hospital and Flawless Face and Body Center before transitioning to public service, where she now serves as medical coordinator for the Adolescent Health and Development Program of the city. Let us all give our undivided attention to Dr. Justin Hernandez.
Good day to our dear partners and fellow graduates from Santiago, Binyan, Manila, Naga, Mandaue, Iloilo, and Iligan. In behalf of our beloved Mayor, Mayor Imelda Aguilar, Vice Mayor April Aguilar, and the OIC of Las Piñas City Health Office, Dr. Juliana Gonzalez, I am proud to present our journey with TCI in the improvement of our adolescent health and development program in our city. The current population of Las Piñas City is 628,652 based from the 2025 data from the Department of Health. From this, adolescents between 10 to 19 is 107,113, which is 17.04% of the city's population. The city of Las Piñas has at least 20 barangays and 30 health centers. These health facilities are all Level 1 accredited for adolescent-friendly health facility. Aside from 30 Level 1 AFHF health centers, there are 3 teen centers in the city, 2 teen hubs, which is a school-based teen center, 1 social hygiene clinic, and 1 LGU birthing clinic. At present, there is no LGU-owned hospital in the city of Las Piñas. The data for modern contraceptive prevalence rate and adolescent birth rate prior to the presence of the challenge initiative include the following. There is a fluctuating trend of MCPR as opposed to the national target. With respect to adolescent birth rate, some fluctuating trend is observed. There was increase in ABR from 2021 to 2022. It is noticed that there are more reported pregnancies than the deliveries and live births. The reason might be that they transferred to a different place to avoid any issues after they are diagnosed with adolescent pregnancy. Sometimes, they tend to hide the pregnancy and opted to deliver in the province. Our city was included in the third batch of the Challenge Initiative and immediately formed the city leadership team. We had our 3D program design workshop last July 10, 11, and 12, 2023, and we were able to extract the problems faced with the adolescent program in our city. Namely, different adolescent stakeholders have services for the youth that sometimes are just duplication from another partner. Services are fragmented or disjointed. No policy harmonizing the different efforts being exerted by various agencies that are prioritizing adolescent welfare, and no identified leader or proponent. The project objectives include the following. To create a protocol that can unify all adolescent serving institutions into a functional network by 2024. To create a functional referral algorithm unifying the branches of health, social welfare, education, and security by 2023. To capacitate the ISDN members to develop policies and monitor implementation of the network. To capacitate frontline workers in the screening and referring adolescent concerns to the appropriate channels. The major strategies include identifying the stakeholders and identifying service delivery points, workshops on the establishment of ISDN for adolescents, identify frontliners and point persons for referral network and capacity providers, development of communications plan, and targeted demand generation and health promotion. In each major strategy, there are activities and steps made easy in identifying stakeholders and mapping of existing adolescent-friendly facilities. There was a development of protocols during the establishment of ISDN, as well as ongoing training for frontliner. After launching last December of 2024, we have a plan for community engagement and proceed with monitoring after testing. For the timeline of activities, last December 4, 5, and 6, 2023, a 3D live-in training workshop on the establishment of information and service delivery network for adolescents, and participants were from the different adolescent stakeholders such as CHO, DepEd, CSWD, PNP, LYDO, PESO, and SK was given by CPD. Follow-up meetings were then conducted last January 25, 2024 and February 26, 2024, which are the follow-up meetings with the team to finalize the directory and the referral algorithm. There were also a series of case management conferences involving the different stakeholders, which became a venue for us to discuss further and enhance the referral pathways. The first case was presented by the City Health Office. The second case was presented by PNP. Their office was able to present the protocol and the process of dealing with adolescents, both with less and more serious crimes. The third case was presented by the DepEd, and they discussed abuse cases in school and the process on how they deal with the cases. In the beginning, we are pushing for the ISDN of CPD. However, we have now the CADA network of the DOH, which is almost the same. We were called to joint hearing in the City Council last September 17, 2024 to present the ordinance and explain its importance to our program. It was authored by our SK Federation President and the Counselor for Health. The DOH CADA Network, or the Key Assistance for Developing Adolescents, is an initiative of the DOH, Department of Health, aimed at improving the well-being of adolescents, particularly in the area of sexual and reproductive health. The CADA network recognizes the vulnerabilities faced by adolescents, such as increased risk of STIs and HIV, early sexual initiation, unwanted pregnancy, abuse, and mental health issues. It aims to provide them with reliable information, guidance, and support from trusted adults in a safe and non-judgmental environment. CADA Network was signed into an ordinance on September 23, 2024. On December 6, 2024, the launching of the Information and Service Delivery Network for Adolescents and the CADA Network was done. There was also the pledge of commitment signed by the different adolescent stakeholders. After completing the strategies and implementing the interventions, we were able to finally produce the ISDN directory. Here is the cover of the directory and the list of services. The main offices were also listed, as well as the teen centers and all 20 barangays with their contact number of the barangay hall, health center, VAUSI, and the BCPC. Also, the list of the point person was also listed in the directory. This is the final product. I really wanted it to be ring-bind for easy editing and replacement of content if ever there will be changes in the future. The next selected slides that I will show are the referral pathways based on where the adolescents seek consult and the process that they will follow. This one deals with adolescent pregnancy detected in school. This is the algorithm of adolescents who seek consultation in health centers. This one is on adolescents seeking consult in SK offices. This algorithm is a referral pathway for child abuse. In the realization of our project, there are lessons learned. First, we have a good relationship and communication with adolescent stakeholders and partners can make our goal easier to achieve. Dedicated adolescent stakeholders are important and crucial in the realization of this project. There will still be continuous trainings for adolescents and will focus mainly on life skills to make them more resilient in times of stress and problems. Coordinating with the Health Promotion Unit to help us in the monitoring and evaluation of our trainings and workshops. There will also be a regular meeting of the city leadership team to assess the different activities of each office and can also be a venue to discuss plans involving the young population and an avenue for the improvement of the services offered for our adolescents. For the family planning program of Las Piñas in terms of MCPR, the increase in the numbers can be attributed to the additional health workforce which were trained in the PSI insertion. At least 18 HCP were trained, or the healthcare providers. Additionally, the implementation of enhanced usapan enabled the city to pull the figures up to an increasing trend. The city also hired FP implementers to provide additional support through mapping of potential users. I would like to acknowledge the city leadership team and its members who have been truly instrumental in the success of our program. I recognize your contributions and your hard work. Thank you very much sa inyong lahat. As a conclusion, we still have a long way to go for our adolescent health and development program, but we are very grateful with TCI to give us the opportunity and much needed push to improve our services for our adolescents. We are very optimistic that what we have started will be beneficial to our young population in the future. Thank you very much, and we hope to have more future partnerships with you. Good day, and God bless us all.
Thank you, Doc Justin. I myself am witness to how Las Piñas City's multi-sectoral approach developed, from a small team into a coalition of advocates and champions for the youth. Beyond the scope of their programs, the city leadership team of Las Piñas itself serves as a promising blueprint for other cities aiming to build stronger support systems beyond the health sector.
So after hearing from our speakers, I'm sure some of us in the audience have our heads abuzz with information and questions. We enjoin those who wish to learn more to ask questions. Just type your questions on the Q&A box located at the bottom of your screens. Our online team will relay these questions to our panelists who will provide a response later this morning. For those who wish to learn more about how FP and ASRH can be adopted into public health programs, please visit our TCI University website, tciurbanhealth.org, for more information. A post-webinar toolkit containing the case stories and other learning materials will also be made available to your emails within 1 month from our webinar's conclusion. Before we proceed to our next segment, we would like to acknowledge some of our guests from our partner cities who are watching us today. From our alumni partners, we have Dr. Evelyn Rimanda of Manila and Dr. Riza Esguerra of San Jose, who presented during our last webinar. Welcome. Welcome to our webinar. Also joining from their own viewing circles, we have the Iligan City Leadership Team, Dr. Glenn Manarpaak, Mr. Al Madale, and Ms. Evelyn Madrid. From Cagayan de Oro, Dr. Liova de Guia. From Naga, Ms. Joy Macaraig. From Mandaue, Dr. Ira Flores. From Iriga, Dr. Ronald Perenya. From Tagum, Dr. Dinah Fajardo. From Isabela de Basilan, Ms. Joy Puno. From Mandaluyong City Leadership Team, Doctors Emily De Taro and Camille Mascardo. From General Santos City, Ms. Judith Hanyola. And from the Zwilig Family Foundation, our chair, Dr. Manolet Dairit, our president, Mr. Austir Panadero, and Dr. Jelix Naknak, and our chief of party, Dr. Anthony Faraon, who we will hear more from later. Welcome, everyone. We now invite our partners from the Commission on Population and Development to share their impressions of today's presentations. We have the regional directors of Region 6 and the National Capital Region. Let us start with Ms. Jacqueline D. Robel of CPD-NC. Jacqueline D. Robel, or Ma'am Jackie, is currently the Regional Director of the Commission on Population and Development, National Capital Region. With over 2 decades of dedicated service in the field of population and development, RD Jackie brings extensive experience in policy development, planning, and program evaluation. Prior to her current role, she led the Planning, Monitoring, and Evaluation Division at the CPD Central Office from 2013 to 2022 and served briefly as Chief of the Policy Analysis and Development Division in 2021. RD Jackie holds a master's degree in population studies from UPPI and a bachelor's degree in communication, major in communications research from the University of the Philippines, Diliman. Her career reflects a strong commitment to evidence-based policy and public service, making her a vital force in advancing population and development programs in the country. Let us all welcome Ms. Jacqueline D. Robel.
Thank you very much, Ms. Laika. Good morning, everyone. Masayang pamilya po sa lahat. To all our colleagues from the Swelling Family Foundation, the Challenge Initiative, to all the local government units, participating in this webinar series, and to all the graduates. Magandang umaga po sa lahat. Today, as we gather for this milestone graduation ceremony and webinar, I rise with deep admiration and renewed hope. Having seen firsthand the resilience, ingenuity, and commitment exemplified by the cities of Las Piñas and Iloilo. Their stories are more than success narratives. They are testaments to what courageous leadership and community-centered approaches can achieve even in the face of profound challenges. What we are celebrating today is not merely a checklist of completed activities, but a powerful story of transformation driven by leadership, coordination, and a deep commitment to the health and well-being of adolescents. Let me begin with Las Piñas City, home to over 628,000 residents with 107,000 or 17% of the population were adolescents. The Las Piñas City leadership team acknowledged a crucial truth. Adolescents need more than services. They need safe, responsive, and coordinated systems that respect their dignity and meet them where they are. Before TCI's involvement, Las Piñas confronted serious challenges such as fragmented services, duplicated efforts, lack of policy harmonization, and no clear referral pathway for adolescents. Most concerning was the rising trend in adolescent pregnancies, partly hidden due to underreporting and social stigma. But our colleagues there, health workers like you, stepped up instead of being overwhelmed. The Las Piñas City leadership team chose to lead. They mapped facilities, identified service gaps, and did not wait for perfection to begin. Instead of being daunted, the team acted with resolve. With clear goals in sight, they laid down strong foundations, a functional information and service delivery network for adolescent health and development that brought together health, education, social welfare, and law enforcement. A referral algorithm that now guides frontliners in managing adolescent cases with accuracy and compassion, and a citywide training program capacitating healthcare providers and stakeholders to understand adolescent needs and respond effectively. 30 health centers in the city are now level 1 accredited adolescent friendly health facilities, each serving as a safe and structured space for young people. The presence of three teen centers, social hygiene clinic, and an LGU birthing facility further broaden access despite the absence of an LGU-owned hospital. One of the major milestones was a 3-day live-in ISDN training workshop held in December 2023, where stakeholders from the City Health Office, DepEd, CSWD, PNP, LYDO, PESO, and the Sangguniang Kabataan came together to forge a unified response. From that workshop emerged not only a protocol, but a sense of shared ownership. Following this, Las Piñas finalized and launched the ISDN directory in December of 2024, a tool that now helps frontline workers connect adolescents to appropriate services at the right time with the right approach. More than numbers, what stands out is the culture of collaboration Las Piñas has built. They did not work in isolation. They built bridges between agencies, barangays, and the youth themselves. And today, the outcomes are telling. With 18 healthcare providers trained in PSI insertion, enhanced usapan sessions gaining ground, and FP implementers mapping potential users, the city's modern contraceptive prevalence rate is finally trending upwards. These accomplishments tell us something powerful. Leadership is not about waiting for perfect conditions. It is about creating them. It is about turning fragmented efforts into a functioning system and turning hesitation into action. Let me emphasize this did not happen by chance. It was made possible by health workers like you who showed up every day, even during difficult transitions. Your ability to adapt, to learn, to implement, that is leadership in action. Now, allow me to shift our lens to Iloilo City, a city brimming with culture, education, and the rising movement in adolescent health advocacy. Their journey too was far from linear. The pandemic hit just as their adolescent health and development program was gaining traction. Momentum paused, teams dispersed, services halted. But Iloilo did not fold or quit. Instead, they recalibrated. With TCI support, they revived their ISDN and retrained new generation of leaders. The transformation wasn't just structural, it was deeply personal. Program officers who once doubted their roles found purpose as advocates, change makers, and mentors. Their approach to demand generation was, in a word, inspiring. Initiatives like Katin Aran, Tinad, Newsting, Balay Kating Aran didn't just inform, they empowered, they gave adolescent platforms to speak, spaces to feel safe, and tools to shape their own health narratives. What ties Las Piñas and Iloilo together is not just their partnership with DCI, it is their bold choice to own their future. They have shown us that when leadership is both inclusive and accountable, systems transform. When adolescents are not just recipients but participants, lives change. So, today, let us not just celebrate their graduation. Let us carry forward their courage, their clarity, and their conviction. Let us replicate, adapt, and scale what worked because what's at stake is not just a program's continuity, but an entire generation's well being. To the teams of Las Piñas and Iloilo, thank you. Your leadership lights the path for others. May your efforts continue to ripple across our islands, proving that in every corner of this country, hope, health, and equity are not distant dreams. They are decisions we choose to make. Thank you very much. Congratulations to all the graduates. Magandang umaga po sa lahat at masayang pamilya.
Masayang pamilya po, RD Jackie, maraming salamat po for your message. Your insights about the situation on our region, specifically in Iloilo and Las Piñas, reflect what has been relayed through our presentations today. Maraming salamat po. Next, we hear from the Regional Director of CPD Region 6, RD Harold Alfred Marshall. RD Harold, or RD Ham, finished his Master of Health Social Science from the De La Salle University, Taft, through a Ford Foundation scholarship. His bachelor's degree in Community Development Economics from the University of St. La Salle in Bacolod. He joined the Commission on Population and Development as a planning officer, then head of the technical division before assuming his current position as regional director of CPD since 2013. Let us all hear from RD Harold Alfred Marshall.
Okay, so again, good morning everyone. To my, like I said, NCR counterpart, si RD Jackie Robel. Okay, to the LGUs who are present right now and all participants. To Doc Justine, to Richard, my staff, to the Zwelig Family Foundation, and to all those who are into the challenge initiative. Good morning. And I really appreciate what RD Jackie said. In fact, she said almost all the things I want to say. But just make me, I will not delve into the individual LGUs. I just came up with my own impression, observation of how these Iloilo City and Las Piñas City approach the issue of really addressing the challenges of providing services for adolescents, whether it's outright um, answering adolescents or through other approaches of family planning, for example. Now, what I observe as far as these two LGUs are concerned is how streamlined, harmonized, rationalized, integrated their approach is to addressing the challenges of adolescent health. Uh, why do I say this? Probably 20 years ago, 20 years ago, 30 years ago, the probably the approach could have been piecemeal. Now we see an integrated approach, harmonized approach, streamlined approach to addressing AHD concerns. Why we might ask? Um, the challenges are evolving. It's getting complicated. I don't know, 10 years from now, I don't know how the challenge of addressing adolescent health would look like. And with that, our programs have to evolve with the changing times. And that's how I see these two hardworking LGUs approach their issue. So there is no standalone program to address AHD. Now we have come to realize that it takes a whole of government, whole of nation approach to really address adolescent health, adolescent issues, challenges facing adolescents, whether it's at the policy level, program level, project level, and also at the research, monitoring, and evaluation level. That's why you just can't make this up. And what the good doctora presented, what Iloilo City presented with all the graphs. They show a decline in the cases of adolescent births. And that is really one thing we need to pursue, a very strong monitoring and evaluation system to convince policymakers, local chief executives that really investing in our adolescents is critical in order to achieve that level of healthy society. Okay, so and in doing so we can come up with a um feasible way of really contributing to achieving the goals of universal healthcare. And we see all the various strategies being employed by R2 LGU. So they're into capacity development, social infrastructure. So social infrastructure, like they come up with a collaborative mechanism in order to look into the various facets of adolescent health and development. Okay, so there's a they've come up with coordinative mechanisms to really look at these various facets. No office can tackle the issue of adolescent health, adolescent pregnancy on by itself. So it has to people have to come together, and we have seen this. We have seen this in these two cities of Las Piñas and Iloilo, and um, hopefully, we can see a well. Obviously, it's there. sense of sustainability. You know, time is very fickle. One after 3 years, it might look different. After the local chief executive's term, it might the policy, the program might change, and hopefully with these programs and collaboration in place, we hope to see this go further than what we are seeing now. And hopefully the next round of presentations, when we visit these two cities, we will see really a concrete steps to really address the issue being faced by adolescents in these two cities. And I do hope the city of Las Piñas and Iloilo, the cities of Las Piñas and Iloilo will be the standard in which everybody will be judged, will be measured, and yeah, hopefully they will all succeed in their efforts, no? And truly make this a watermark for all to follow. So with that, collaboration, streamlining, harmonizing, rationalizing our programs, mainstreaming AHD, okay, and our programs and services. So congratulations to the cities of Iloilo and Las Piñas. Thank you very much.
Maraming salamat po, RD Ham. Your insights reflect the strategic value of these local practices and how through a whole of government approach, they can be sustainably scaled to more cities across the country. Again, maraming salamat po. At this point, we are opening the floor for questions and comments from our Zoom participants. If you have a question or point of reflection, please use the Q&A feature on the bar below. To start off, we have some questions directed specifically to our presenters. First, we have Iloilo City. May we ask Ms. Arlene Boteros, are there any key leadership strategies or approaches that help Iloilo overcome challenges in implementing sustainable health initiatives?
Good morning, everyone. Well, Iloilo City overcomes initial challenges in implementing sustainable health initiatives, particularly among adolescents and mothers, through several key strategies centered on, una-una po, capacity building, community engagement, and multi-sectoral partnership. First, Iloilo City Iloilo City government invested in training a broad network of health workers and volunteers, including population program officers, our BSPOs, and barangay health workers. These trainings ensured that health advocacy and services were accessible and adolescent-friendly, which helped build trust and increase utilization of health program among the target populations. Second, the city is constant in community engagement through the conduct of numerous outreach activities and demand generations initiatives to raise awareness and encourage community participation, thus effectively creating a supportive environment. Moreover, Iloilo City established 12 adolescent-friendly health facilities to include our youth centers, which respects adolescents' privacy and address their specific health needs. strategies and innovations under adolescent and RPFP include Healthy Young Ones, Kwentuhang Pangkabataan, Parenting Talk, and Mothers Classes, among others. Adolescent health and development programs are conducted not just in barangays, but in school as well. This approach helps address challenges such as social stigma, misinformation, and lack of access. Finally, Iloilo City forged strong partnerships with local, national, and international organizations as among its key leadership strategies, such as, of course, the Challenge Initiative, DepEd, DOH, CPD Region 6, and FPOP. These collaborations facilitated resource mobilization, technical support, and implementation of comprehensive programs which targeted not only adolescent pregnancy, but also mental health and HIV/AIDS. The support of Iloilo City government through the Office of the City Population Officer, City Health Office, and CSWDO, and other stakeholders ensured a coordinated and sustainable response to overcome initial challenges in implementing sustainable health initiatives. That's all. Thank you.
Maraming salamat po, Miss Arlene. Thank you for sharing that. I think there is so much to learn from the experience of Iloilo City. It's it's inspiring to see how collaboration played a role in overcoming your challenges. And you placed strong emphasis on community engagement because I think it's important because that's what we need to build sustainable and impactful health initiatives. Thank you very much for again. Now, I think we have another question directed to Iloilo City. Can you share a specific example of how local commitment positively impacted the success of a health program? Miss Joy Subido? Miss Florence Joy Subido. Ayan, magandang umaga po.
Good morning. Maayong aga sa tanan. By the way, ma'am, I am Florence Joy Rubido. So, as a program manager of the Adolescent Health and Development Program of Iloilo City Health Office, I want to highlight or to commend how Barangay Suok's commitment, especially for being the first barangay in Iloilo City to allocate budget for a barangay-based Adolescent Health Summit. 20,000 last year and 30,000 this year. The barangay officials truly understand the urgency of addressing the health and social challenges faced by their young people. And that kind of leadership sets an important example we hope other barangays will follow because we are planning to replicate this kind of activity to other barangays. It takes strong collaboration and persistent advocacy from the health sector to convince local government units to invest in adolescent health. Building trust between agencies is essential because once that trust is established, real synergy happens. Barangay Sook, being vulnerable community and a relocation site for families from different parts of the city with mostly low incomes, faces unique challenges. But with the right interventions through the AHDP, we see real potential, not only in reducing teenage pregnancy, but also in breaking the cycle of poverty and uplifting the lives of the entire community. Thanks to their budget support, we've been able to reach over 200 adolescents through our Adolescent Summit, offering education, empowerment, and vital health services. Topics like mental health, reproductive health, substance abuse prevention, HIV and AIDS awareness, and youth empowerment are all part of the program. The barangay's involvement has also allowed us to provide on site counseling, health checkups, and workshops led by experts. Services that equip young people with the knowledge and resilience to make healthier choices. Looking ahead, our vision is to make these activities more youth led, which will make them more transformative, sustainable, and deeply impactful. We believe that when young people take ownership, the change becomes more meaningful and long lasting. Part of this plan includes establishing a youth center in Barangay Sook to serve as a hub or a dedicated space for learning, support, and empowerment. This partnership with Barangay Sook shows how vital local commitment and leadership are. When local governments seize the value and invest their youth programs like AHDP can create lasting, meaningful change. We look forward to continuing this collaboration to support and uplift even more young people in the community. And we would like these adolescents to access quality care for them to be prepared for healthy adult. That's all. Thank you. Kag madamo gid nga salamat.
Maraming salamat po, Miss Robido. It really shows how local commitment is important, from allocating funds from the barangay level to actively engaging stakeholders. It can really drive meaningful and sustainable change. I think your experience also highlights the power of grassroots and youth led ownership and strategic leadership. It's really inspiring to hear stories like this from the ground. So maraming salamat po, Ms. Rubido. Now we go to Las Piñas City. We have a question for Dr. Justine Hernandez, one of our speakers. First, Ma'am, looking ahead po, what are your next steps to further strengthen the health initiatives of Las Piñas City? And how do you envision scaling these efforts to benefit your surrounding regions or cities?
Good morning, everyone. So for the next step of our city, as I have said earlier, we still have a long way to go for the for our efforts for the adolescents. But one thing I think that is really very beneficial for our city is to have the establishments of the teen centers. The teen centers will serve as the catchment basin for our adolescents, where they can go there and they can express themselves and be able to, whenever if they have any problems, they can we can refer them to our partners in the city. So I think our efforts, they will serve as inspiration to our surrounding regions, that if we can do our initiative for the adolescents, they also have the capacity to do it to other cities. So final that's me answer. So I'm planning also to have continuous meetups with our city leadership team, of course, so that we still have a continuous plans and innovatives if ever we are faced with different problems or situations in the future. We will still have that good communication with our stakeholders. Thank you.
Thank you po, Doc Justine. I think it's a really thoughtful strategic plan that you have laid out for Las Piñas City and how your programs, your initiatives can be replicated for other cities. So thank you very much. We have another question for Las Piñas po. So given your leadership journey, what were your impressions regarding the effect of the interventions in your city and at at the national level?
Okay, for our journey sa adolescent, I think beneficial na yung stakeholders with the adolescents, we have the same goal for the adolescents. So, kaya we are able to come up with our directory. The directory will serve as the point system or our referral pathway para at least alam ng lahat ng partners what they will do if ever they will encounter adolescents. This will serve as their guide on how we will deal with adolescents. And of course, it will still be a continuous process, like as I have said earlier. And sabi ko nga, since nagawa namin sa city namin with a good relationship with the adolescent stakeholders, hopefully we can also inspire other cities, other regions, and hopefully buong Pilipinas, 'di ba? Na if we can do it, you can also do it in your level sa city nyo. Yun. And eventually, sana we can reach more adolescents para at least they know na we are open, the city is open for our adolescents na to prevent them na mag-solo lang sila sa problems nila, na they can come to their rescue kung ano man ang pwede nilang puntahan. Like sa school, we have good partnership with the school, with the um, SK, no? So maganda yun na at least they know na they are not alone. We should always let them know na they are not alone. We are always here for them.
Maraming salamat po, Doc Justin. Ang ganda po na we want our young people to have safe spaces so they won't feel alone, that they have someone that they can talk to when they have problems. This is the importance of having accessible and reliable information for our young people. And of course, we want these young people to trust our healthcare providers, to trust our spaces, that it's safe, it's safe for them. And it also enhances yung reach and effectiveness of our program. So thank you very much for Las Piñas for creating these spaces. Thank you po. Okay, now we have a lot of questions coming in from the Q&A chat box. We have questions for Iloilo. Sir Richard, may we ask you to answer these questions? We have a question from Ms. Del Pilar. During the presentation, it was shown that one of the challenges in adolescence was sexual abuse or STIs. I would like to ask if there were interventions put in place for the victims.
Okay. Yes. So, good morning, everyone. As far as our adolescents experiencing abuse and having concerns on sexually transmitted infections, the Iloilo City has made sure that there is a network of available services made accessible to them. So the information and service delivery network, which has been established by virtue of an ordinance in 2017, has been in place and really ensuring that our city health office and our city social welfare and development office, including the local Philippine National Police, are involved in that network. So every time that there is a focal point or area wherein adolescent airs his or her concern, that facility, for example, the teen center, is aware and equipped as to the referral system, and could accordingly refer said adolescent within the network. So as far as our adolescent clients are concerned, there is a mechanism set in place for them to access their desired and needed services.
And thank you, Sir Richard. I think it's really important that our reproductive health interventions for STIs and abuse emphasize prevention and early detection and treatment. And it's good that Iloilo City has a comprehensive support system supported by collaboration from different sectors, and that you have this effective referral system to ensure safety, confidentiality, so that it could aid in the healing and overall well-being of our survivors. Thank you, Sir Richard. So we have another question for Doc Justine of Las Piñas. How are you able to reach out to out of school youth in terms of getting their profile and providing services?
Okay, for our out of school youth, we have a good relationship with the CSWD. So the PIAP is under the CSWD. Kaya we have some we gave trainings to them sa ating mga out of school youth. Ini-involve natin sila sa mga activities ng AHDP. For the profiling nila, usually the office na office na in charge kasi sa kanila is the LYDO, which is also a part of our CLT team. Kaya we also have that good and also for the SK offices, we also have a good relationship with them. That's why we are able also to reach out for the out of school youth. And sometimes we invite them to our activities. If we have the Adolescent Congress, they also go there. Yeah. So, okay naman for the out of school youth. But I think ang isang kulang din kasi sa amin is the profiling of all the adolescents. But we have a new policy na ginawa ni SK Fed din na they are passing the policy for the registration of all youth organizations, including all members. So maybe with that small step, we can be able to get the profiles of, if not all, almost half or almost 80% of the adolescent population.
Thank you, Doc Justine. I think gusto natin, yun yung mga gusto nating ma-reach out, and not just the general youth population, but also our out-of-school youth. So it's good that you have good communication and that you are starting to think na in the pipeline, you need profiling of these individuals para we can reach them easier. Thank you. I think we don't have time for more questions. That is the last question that we can address for today. We thank those who submitted their questions through the Q&A button, and to our speakers and the rest of the city leadership teams for providing valuable insights. Thank you very much. We hope this learning forum has indeed provided a lot of learning for everyone. For those who still have questions, our cities will answer them in the Q&A box in the chat. So these will also be compiled and included in our post-webinar toolkit. If you have any other questions and inquiries, you may contact us through our socials. Please follow us on Facebook, the Challenge Initiative Philippines, or email us to tci.ph@zwilligfoundation.com. Okay, so now we are finally here at the most exciting part of our program, the formal graduation of our partner cities. Today, we recognize the strides achieved by Iloilo and Las Piñas City in developing adolescent-centered services and their sustained commitment to community-centered reproductive health services. Their mayors and respective CLTs have successfully completed the curriculum of TCI, and they have played significant roles in the implementation and scale up of proven high impact practices for family planning and adolescent health. First, on the virtual stage, let us congratulate the city leadership team of Iloilo. Iloilo City has been awarded as a global self-reliant city in family planning and adolescent sexual reproductive health. This award is in recognition of the city's outstanding leadership and commitment in implementing high impact practices, demonstrating a clear and steadfast dedication to improving the health and well being of urban communities. They are led by Honorable Jeronimo Jerry Treñas, supported by Ms. Maria Cecilia Gilliega, Dr. Mary Ann Polly Diaz, Teresa Helogo, Mona Lisa Dionas, Richard Maguliado, Arlene Botero, Nolene Padrigo, Elizabeth Hersanova, Flory Ann Tacuba, Mary Joy Rapadas, Yani Rose Tuazon, Virgie Villanueva, Jocelyn De Los Santos, Kate Jude Ibanez, Florence Galanto, Ana Sheila Moreno, and Ryan Dave Estrella. Congratulations, Iloilo! Thank you very much for rising up to the challenge. Hello. Maraming salamat po. We also would like to acknowledge the guidance of their regional partners. The Department of Health, Western Visayas CEP under Dr. Annabel Yumang, and the Commission on Population and Development Region 6 under Director Harold Alfred Marshall, with his staff, Richard Maguliado and Roylo Vincent Laguna. Thank you! Maraming salamat po, Iloilo. Next on the virtual floor and watching us from their venue, the city leadership team of Las Piñas. Piñas City has also been awarded as a global self-reliant city in family planning and adolescent sexual reproductive health, in recognition of the city's leadership and commitment in implementing high-impact practices and interventions, demonstrating a steadfast dedication to improving the health and well-being of urban communities. They are led by Honorable Mayor Imelda Aguilar, Vice Mayor and incoming Mayor Honorable April Aguilar, and SK Federation Honorable Ray Angelo Reyes. Congratulations, Las Piñas CLC, Dr. Juliana Gonzalez, Dr. Justine Hernandez. Congratulations. Ian Dennis Cruz, Dr. Arvin Marbibi, Angel Urbano, Lenny Fe Aguilar, Maria Rodette Apolonio, congratulations. Dr. Mylene Hu, Clymen Jose Espiritu, Police Staff Sergeant Chriselle Malaya, Brian Ray Dolatre, Dr. Maria Emily Kalimisan, Dr. Phoebe Valle, Dr. Kathleen May Varnan, Zaira Marie Bronya, Lani Espiritu, Roel Mojeca, Kate Sosa Ancheta, Dr. Melinda Soriano, Lani Espiritu, and Adrian Bongalong. Congratulations, Las Piñas! Thank you. Can wave to the camera. Be recognized. We would also like to acknowledge the guidance of their regional partners, the Department of Health Metro Manila CHD, led by Dr. Lester Tan, and the Commission on Population Development NCR under RD Jacqueline D. Romero. With her staff, Mary Jane Casimiro, Domini Bosacay, and Mirasol Silva. Congratulations, Las Piñas! Maraming salamat po. Again, we congratulate the local government leaders, health officers, and program implementers who have championed youth-responsive and inclusive services. May your success here serve as an inspiration for other cities aiming to improve adolescent reproductive health in their own cities. As we close this 3-day webinar and graduation, again, we encourage everyone to complete the post-session feedback form linked in our chat. Your input helps us improve future learning sessions and supports our CPD accreditation process. Certificates of attendance will be made available for those who have registered via our link and attended and evaluated the webinar. Make sure to accomplish the evaluation form within 7 days from the end of the webinar. Evaluation is open until June 6th. Case presentations by our participating cities will be made available after the webinar. A recording will also be made available via Facebook. So make sure to follow us on our socials and make sure you are updated. And now, to formally close our last day session, we are honored to hear from the Chief of Party of the Challenge Initiative, Dr. Anthony Faraon. Doc Tony, as everyone calls him, is the Chief of Party of TCI-Philippines. He holds leadership roles in several organizations, including the Philippine Society of Public Health Physicians, the National Pharmaceutical Foundation, and the Health Committee of League of Corporate Foundations. His previous roles include leading the Palawan Access to Medicines Project, consulting for Ateneo School of Government, and teaching at the New Era University. Dr. Tony holds a medical degree from the University of Santo Tomas and a master's in public health from Dr. Fidel Mundo Medical Center, a master's in public management from Ateneo de Manila University, and has completed the management development program at the Asian Institute of Management. Let us all welcome Dr. Anthony Faraon.
Maraming salamat, Laika. Isang magandang tanghali po sa ating lahat. Ang 3 araw na ito ay puno ng inspirasyon at pagbabago. Hence, as we close this learning series and colloquium, we in the Zuilik Family Foundation's the Challenge Initiative Philippine Hub is filled with immense pride and gratitude for the collective energy, innovation, and commitment we have witnessed. Sa mga lungsod na nagpresenta, mga partner, at sa lahat ng mga dumalo, maraming salamat dahil ginawa ninyong espesyal ang pagtitipon na ito. Hindi lamang ito naging isang webinar, kundi isang pagdiriwang ng maayos na liderato ng komunidad at makbuluhang pagbabago sa family planning at adolescent sexual reproductive health o ASRH. None of this would be possible without the unwavering support of our partners. First, to the Challenge Initiative or TCI Global, your vision and the investment have empowered cities, not just in the Philippines, but across many countries, to lead with evidence, scale that works, and reimagine health systems for women and young people. To our champions at the Department of Health and the Commission on Population and Development, both at the national and regional levels, thank you for your policy guidance, leadership, technical guidance as well, and relentless drive to make universal healthcare, including family planning and ASRH, a reality. To the 24 TCI-supported cities, especially our 8 presenting cities these past 3 days, your courage to innovate, adapt, and own solutions tailored to your communities is the heartbeat of this initiative. And to all other partners, NGOs, youth advocates, health providers, and civil society, your collaboration fuels this movement. Over these 3 days, we've seen how local governments are dismantling barriers and building bridges. Iligan showed us how proactive leadership can accelerate family planning. Naga demonstrated holistic strategies to reduce teen pregnancies. Santiago proved that peer education empowers the youth. Binyan innovated outreach to meet women's diverse needs. Mandaue brought care to the doorstep with their women's health caravan. Manila reignited the Bayanihan spirit for marginalized communities. Iloilo redefined adolescent-friendly healthcare spaces. And Las Piñas wove a safety net through multi-sectoral collaboration. Each story reaffirms that local ownership and people-centered governance are not just principles. They are practices that save lives and uplift rights. Three themes emerged. First, integration, linking family planning and ASRH strengthen entire health systems. Second, gender equity. Progress requires challenging norms and amplifying women's voices. And thirdly, sustainability. From pilots to policies, lasting change needs institutional commitment. The cities also showed that data-driven decisions and community co-creation are non-negotiables. Kaya naman po, as we live here today, we in the Challenge Initiative challenge you. Unang-una ho, to scale up. Take successful models to new barangays or even to new cities. Second, partner boldly. Engage more private sector, academe, NGO, civil society, and youth leaders. Third, advocate. Push for budgets and policies that prioritize women and adolescents. And lastly, share fearlessly. Like what you did the past 3 days, people will learn that your lessons are lifelines for others. The next chapter of TCI Philippines depends on you. Let's move from proof of concept to proof of impact. Sa ating mga alkalde, mga city leadership team, at mga frontliner, kayo ang tunay na bayani ng ating adhikain. Sa ating mga kabataang kalahok, hindi lamang kayo mga benepisyaryo, kayo ay mga tagapagtaguyod ng pagbabago. At sa lahat ng aming partner, salamat sa inyong tiwala na magagawa nating pantay at makabuluhan ang serbisyong pangkalusugan, lalo na sa mga kabataan at mga kababaihan. Maraming salamat po. Let's continue to build a future where no woman, no young person is left behind. Mabuhay po tayong lahat. Thank you. Over to you, Laika.
Thank you very much, Doc Tony, for your forward-looking message. Your words remind us that while today's event marks a milestone, it is also a call to action to sustain the momentum that we have built and to continue building responsive systems that truly serve our communities, especially our women and young people. As we close the TCI graduation and webinar series, we reflect on the powerful stories and lessons shared by our city. On our first day, we learned how leadership drives systems change. We learned how a leader listens to his constituents through ground deep dives to hear the individual stories straight from his constituents. We were shown that a leader should care. How Ms. Johanna Gabriel, under the leadership of Mayor Sheena Tan, contextualized her experiences as a mother with those of her constituents. We were shown that leaders recognize the need for like-minded and like-hearted allies, as Mayor Freddie Shao did when constructing his leadership team. On our second day, we learned how our cities applied the TCI process, adopting the high-impact practice of mobile FP outreach and later developing it into something uniquely their own. We heard from Mayor Arman de Maguila Jr., a leader who expressed his vision to his team and created co-ownership in Binyan. We were witness to how Dr. Debra Maria Catulong in Mandaue City harmonized all services in their outreach caravan to align with the life stage needs of women and adolescents. From Manila, we learned from Dr. Evelyn Rimando on how they utilized our existing resources, which are none other than our community health volunteers and centers. They served as a force multiplier, boosting the provision of services through literal door-to-door service provision. And finally, today, we just heard how our partner cities are making strides to harmonize our adolescent health and development services. We learned to move the levers, how Dr. Justine Hernandez and Las Piñas harmonized with other adolescent serving agencies and organizations by developing a referral network to unify their services. And how Mr. Richard Maguliado and the Iloilo City leadership team elicited youth participation through the development of safe spaces where young people are free to express their needs. We have heard from 8 remarkable cities, each with their own context, challenges, and strategies, yet all united by a shared commitment to build stronger, more inclusive, and more responsive health systems for Filipino families and young people. We need champions, responsive leaders that are not only informed by the facts, but also personally feel the issue and have a personal stake in the betterment of their city. It is through this authentic response from which true ownership and quick action is developed. To our presenters and partners and participants, especially those that have stayed with us since day one, thank you very much for your contributions. You may open your cameras so we can see your faces. Thank you. Thank you, everyone. So the series concludes today. The momentum of our work continues. May our hearts burn with passion and our minds remain curious as we continue building systems that truly serve our communities. Maraming salamat po and we look forward to learning with you again soon.